All right, so you've just been diagnosed with degeneration or arthritis. What does that mean? What does it look like? Can and should you get adjusted? So a normal vertebra, a bone, a disc, and a bone, that disc creates a hole and a space for the nerve to come out. The bone is nice and smooth, right? The disc is fat, juicy, and plump. The fatter that disc, the bigger the hole for the nerve to come out. Now your brain is able to communicate down the nervous and through the nervous system to every organ, cell, muscle, tissue inside your body. And the neck, that's a nice curve, and you can kind of see those discs in between each of those vertebrae. That's normal. Phase 1 degeneration or arthritis is when that spine comes out of its normal position when we're talking about the spine. You might see that disc start to get a little thinner, which now we have more chance of nerve interference, stress, or pressure because that alignment of that hole is going to be a little smaller, right? So it's more likely to become pinched or subluxated and affecting that nerve flow or that flow of information. That's phase 1. Phase 2 is where we oftentimes call it arthritis, and that's when we're really going to see the changes, the big changes on x-ray with osteophytes, aka bone spurs, on the bones themselves. So now we start to get these lips, these beaks. The disc now is much smaller. Because that disc was unstable in phase 1, our body is always smart, and so it's trying to stabilize that joint by literally trying to fuse it together. As that disc gets smaller, that hole, that opening for the nerve to come out, also gets smaller. So these are the nerves that are going into your arm, or down into your leg, or for that matter, to your GI system. If that hole is getting smaller, there's less room for that nerve to get out, and so that communication is decreased. And it's much more likely for you to have a problem in those end muscle tissues and organs. Phase 2, if left uncorrected, unfortunately becomes phase 3. This is where there's very little disc space. Typically we have multiple units affected, and so with less disc space, we have almost a complete fusion where these bone spurs, these lips, these beaks are even bigger, right? It's almost a fusion. There's very little motion in that joint, and these nerves are absolutely going to be affected. It might be pain. At this point, it's because this process takes decades to happen. We may have gone from pain or a lot of acute pain to now it might just be where that part of the body just no longer has its function. So if those are the nerves that are going to your arm, you might notice that your hands, the muscles of your hands have decreased in size, decreased in strength, so that they're just not functioning at even close to 100% because there's been so much pressure for such a long period of time on the nervous system. So when can a chiropractor adjust you? Is it just when you're normal? Is it just phase 1 or phase 2? We can't touch phase 3? Well, certainly a chiropractor can adjust you in all of these, although obviously the best choice is to get it before the degeneration happens. So after an accident, an injury, a fall, a problem, when the spine shifts out of position, if that spine isn't shifted back into position, if we don't get normal motion in that joint, it goes through that process from that big healthy joint, and over time, months, years, decades, it degenerates, we get arthritis, and that's just the normal decay process. So if you want to keep this spinal joint healthy, keep the stress off the nervous system, allow your brain to communicate down the spinal cord, not those nerves, it's important at whatever phase of degeneration that you're in, that you get as much motion in there as possible, right? And that motion, again, increases proprioception, but it decreases some of the stress on that nervous system and allows your body to function. And motion in any joint is what keeps that joint healthy and alive. So whether you're in phase 3, phase 2, phase 1, or you're normal, that joint needs motion, and that the quicker you can restore motion to that joint, the healthier it becomes.